So, for the treatment of cancer, surgery is the elimination of cells. If you have a small tumor, it is not highly vascularized. So there is not too much blood entering and exiting the tumor. So your risk of some cancer cells exiting the tumor is substantially lower. So if you remove the tumor, maybe you eliminated everything. When the cancer cell exits the tumor, there are lymph nodes around the tumor, which are like checkposts. So the lymph nodes may restrict the cancer there. That is a somewhat higher risk than if the cancer was localized to the tumor and not having exited. But nonetheless, when it is restricted to the tumor and surrounding lymph nodes, your entire cure may be a complete removal of all the cancer cells by removing it surgically. Now, if the cells have exited and you're not sure whether they've gone to a distant location, now you're at risk because you have an immortal cell, which could be anywhere. So now what you need is chemotherapy, because you're going to infuse drugs using the cardiovascular system, and the drugs will also go everywhere. Okay? Chemotherapy, conventional chemotherapy, by and large, is a blunt tool. It doesn't know which is the cancer. What it is depending on is some of the properties of cancer cells, one of the significant ones being that it actually divides rapidly. So it will try and kill any cell which is in the process of division, which a large proportion of rapidly dividing cells will be in the process of division. But there will be a lot of collateral damage because you have a lot of other cells which are dividing rapidly. And even not so rapidly dividing cells, some of them will get killed because they are in the process of division. So you will get nausea, you will get appetite loss because your intestinal lining has rapidly dividing cells. You will very often have hair loss because they are rapidly dividing cells. The most significant problem will be that your immune cells are rapidly dividing, and you will have immunosuppression as a consequence of the chemotherapy killing immune cells, which we will need to manage carefully. Okay? But chemotherapy will kill cancer cells preferentially, and it's another mode of eliminating cancers. You have some drugs which can either be given by infusion or orally, which actually can target the cancer cells and perhaps very few other cells. So your collateral damage is limited. That is targeted therapy. These targeted therapies quite frequently somewhat expensive, but in the appropriate instances, they may have very good outcomes in terms of eliminating the cancer cells with significantly lower side effects than conventional chemo. Now, your third modality of treatment is radiation. So the way radiation works is extremely different than the way chemotherapy works. What radiation does is that it actually damages DNA in any cell that gets exposed to a certain dose of radiation. Your DNA is the repository of information of how a cell should be made. So imagine that it's the city plan of how to make a city. So you don't want your city plan to be damaged and use the damaged plan to make a new city. So right from the beginnings of life, damage to DNA is viewed by life as a very serious problem. So to correct for this, you have a lot of mechanisms and a lot of checks and balances. This will apply to a bacteria, it will apply to an earthworm, to a bumblebee, a bird, or a human. DNA damage is not a negotiable. Okay? So what you're doing in radiation is inducing DNA damage, once the damage takes place, within minutes, a surveillance mechanism will pick up the damage and it will flag it as damage with a countdown of when it encountered the damage. Now there are DNA repair machineries which will find this damaged location and try and correct the DNA damage. If the thing gets repaired, the flag is off and your cell is back on. If within 18 to 20 hours the repair doesn't happen, this cell will kill itself. It doesn't matter that a cancer cell is immortal. This goes much deeper into the biology of life. This cell does not have an option. It will kill itself if the DNA repair doesn't happen. Now, there are some cancers in which radiation is your first line therapy because they are so radiation sensitive. So most radiation sensitive cancer cells are roughly 50,000 to 100,000 times worse at correcting DNA damage, which is why you get a differential advantage of killing cancer cells relative to normal. This is how radiation oncology works.